Okay, good afternoon, everyone, or morning or evening, depending on where you are in the world. My name is Amanda Godoy, and I'll be chairing this webinar. Welcome to the Canadian webinar about applying overseas. I'm part of the CHIPS committee, the Cardiff Healthcare International Perspective Society, and along with Seth and Eunice, we've been preparing this webinar series for you about applying overseas and pursuing your medical training abroad. And we are very, very happy with the overwhelming response that we've been getting for this webinar. We're very happy that you are here today. Just as some housekeeping rules, please do not turn your cameras or microphones on. You've been muted and you're with your cameras off. So please, let's keep it that way, just so that we can eliminate background noise and distractions. And also, please feel welcome to drop your questions on the chat box. We've been collecting some of your questions from the registration form, but also feel welcome to drop some questions throughout the presentation. Any questions that you guys might have, we're going to have a Q&A at the end to answer all of them. We're going to do our best to try to answer all of them. And yeah, just as a little introduction to our committee, we aim to provide international perspectives, and we try to facilitate international experiences. And we always run academic revision sessions and organize social events. Normally, we are a society based in Cardiff University. And we try to fully engage with our members in every way possible. And throughout this pandemic time, we have been trying to organize some webinars, including this series. So we're very happy that you are all here. Today we have Dr. Mitchell Goldenberg giving an amazing presentation about the application process in Canada. And Dr. Mitchell, or Mitch as he prefers to be called, he's a fifth-year urology resident at the University of Toronto in Canada, and he graduated from St. George's University of London in 2012. After working briefly as a house officer in South London, he began urology residency in 2013. And Dr. Mitch also undertook a PhD in medical education as part of the clinical investigator program, and now he's planning to pursue a career in academic surgery. So Dr. Mitch, the floor is all yours, and thank you for being here.
Wonderful. Thank you for having me, guys. And thank you all for logging in today. It's 9 a.m. here in Toronto, so I'll do my best to be awake on a Sunday. Hopefully this all works. Let's just get this going. All right. I know you guys will tell me if you can't see anything or if you can't hear me. So my name's Mitch. I'm like you just heard, I'm a final year urology resident here in Toronto. Couple of sort of disclosures off the top. The first thing is the nice thing about an IMG is that we're all very different. We all have different paths to get to where we end up. So my path will be different than yours, which means I can give you my perspective. It may mean I don't always understand the paths for everyone, but I'll do my best to try and answer questions and try and sort of speak to the generalities as best as I can. I've served on our program selection committee here in Toronto, so I understand the match process in Canada a little bit and sort of how to rank yourself or how to make yourself stand out. So hopefully I can pass on some of that knowledge to you guys today. The other disclosure just off the top is you may hear my cat in the background. He likes to scream when I'm giving talks. So if you hear someone in the background, it's not a child, it's just a cat. Without further ado, we'll jump in here. So we're going to be talking about being an IMG and applying to the Canadian residency program. In Canada, I know there's all different terms around the world. You all probably know. We don't have interns in Canada anymore. In the US, they still refer to first years as interns, and then second year of postgraduate training onwards, they call residents. In Canada, it's a residency program. There's no internship or anything like that. There's also no rotating mandatory time where you have to spend time on specialties that you don't want to or didn't sort of intend to. But within your residency program, you will be doing months here and there on other services so that you can get a bit of a broader knowledge of healthcare. So let's jump in. So let's talk about the application process. So I'll start off by talking about myself. Again, like I said, my sort of journey may not be yours, and you may not be able to relate to everything, but hopefully you can sort of infer from what I'm saying. So I, first of all, didn't do an undergrad degree. I'm one of those people that went from high school in Canada and applied to the IMG sort of stream at St. George's, which is in Tooting, for those of you who know where that is. So I did a 5-year MBBS program. Some of my friends in medical school did the intercalated BSc is what they called it. So they ended up doing 6 years and had a BSc and an MBBS by the end. I elected not to do that. I wanted to get through med school quickly for whatever reason. Now I wish I had spent the extra year because I had so much fun. What can I tell you? I applied. You're all hopefully at the point where you're in medical school, or if you're not, at that time, I just had to do the UK CAT, which was fairly straightforward, similar to sort of the SATs here. And that was it. I had to sort of maintain my grades, and I got in. I did a 5-year degree. I had a great time. I rotated around South London, got lots of experience, big academic hospitals, community hospitals. Saw lots of different things, lots of sort of good exposure. And then my actual story in terms of coming back to Canada is a little bit complicated. So I'm Canadian. I grew up in Vancouver, lived there till I was 18. When I applied for the Canadian match the first year, so this is in 2012, well, the match was 2012. I was applying in 2011. In my final year of medical school, I actually didn't match the first year. I guess the kind of message from that is that, just because you don't match once or twice, don't give up if it's what you really want to do is come to Canada or to the US, or I'm sure to many other places, because persistence paid off. And I know that story is common to a lot of people that have ended up in programs here. When I applied the first time, I think I had a pretty strong application. I had done some research in medical school, urology specifically, which is where I ended up. One thing that my sort of first piece of advice from a North American program perspective is that they don't really understand the undergraduate medicine stream. They know it exists, but when I applied, the things I heard from people that were in the programs was, "Oh, you're so young. There was no possible way I could have had the same type of experience that a Canadian medical student would have had," which I think in terms of years and maybe wisdom and maturity is probably true to some extent, but that's not universal. And I know a lot of people in the UK who are in the 5-year or 4-year program actually have done undergraduate degrees. Many have done master's degrees. Many are extremely mature and work hard and have children even and things like that. So it's not a universal rule. It was in my case. I was 22. But that could be a barrier for sure, is the perception that a lot of the Canadian programs have about international training. That being said, things are improving, and I have some data I can show you about numbers, and I think things that the tide is starting to shift a little bit sort of away from that to a more positive angle. So I applied twice. The second year I applied, I had worked for a year in Croydon, which is a sort of fairly large community hospital in South London next to Gatwick. And it's a very sort of busy part of the city. I worked in the A&E. I worked in the acute medical unit. I did some surgery time there. So it was valuable to get general medical rotation experience, carry the pager, carry the bleep, as you guys call it, which I haven't called it that in a long time. It was of value. And when I applied the second time, I went into the interview process a lot more confident and able to speak about the experiences that I had had working, going to codes and running chest compression, stuff and dealing with really sick patients. And I think that added a lot to my CV when I applied the second time. So courses, I didn't do an undergraduate degree. What I can tell you is that now medical school and definitely residency programs here, I think when you're applying for training, I don't think anyone is too concerned about your undergraduate experience. I don't think that weighs in, as long as you're from it's more about your medical school time. And so in terms of courses, I didn't do any real significant academic extracurriculars when I was in medical school. I played sports. I I did some extra anatomy teaching. I did some clinical skills teaching because I love teaching more than I love the subject matter. But yeah, so I think just, make sure you're as well-rounded as you can be. I think that always helps. I also played trumpet in the medical school musical society, so that was fun. Why Canada? Well, for me, I'm Canadian. That's kind of an easy one for me. What I can say as someone who's not Canadian, Canada is a wonderful place to live. I'm not going to get into politics, but it's a very welcoming society for the most part, in most parts of Canada. We certainly have our problems just like any other country on a systemic level, but things like crime are very low here, depending on where you are, obviously. It was a great place to grow up. So for those of you that have children or want to have children, I loved growing up in Canada. And the medical training here is excellent. Most Canadian academic, most residents leaving Canada, especially in the specialty programs, get their pick of fellowships. We're sort of desired, especially in the US, because they know we have a very broad and extensive training here. And so it'll set you up for a good career going forward. So I've nothing bad to say about the Canadian postgraduate training sort of setup. It's quite efficient. It's only most programs are 3 or 5 years. So residency for general practice, so for family medicine, is 3 years for the most part. There's some variations of that. If you're doing, you can do ER, so you can do basically you can do emergency medicine as an adjunct to your family medicine training here, or you can do a 5-year dedicated, basically A&E training run through. And I'll talk a little bit more about those programs, which obviously I don't have direct experience with, but I can tell you sort of what I know. Moving on, so the application process, there's a couple of licensing exams that Canadian programs require, but for full disclosure, I did not do the NAC, but came in about a year to 2 after I matched. It's basically a OSCE that you will have to apply for. I believe all programs now require it for IMGs. It's done in, I think, September and March, so it's done in this fall or the spring, and it has to be done within 12 months of you graduating. So it should be you should be signing up to do it basically within your last year of school. And as far as I know, it's just a very general OSCE, tests on everything from psychiatry to emergency medicine to some basic surgery things. So just like your final OSCE that you'll write at the end of your medical school, which I'm sure most med schools still have that, it'll be similar to that. So what I would recommend, having not written it, obviously take that in mind, but I'd probably recommend writing it around the time that you're writing your end of and then the MCCQE Part 1 is there's obviously a Part 2. Part 1 is the sort of knowledge multiple choice computer-based test that, again, you write, and I wrote right at the end of my final year. And again, it's very broad. There's lots of practice material available for that. Canada QBank, I don't get sponsored by them or work for them, but that's just the one I happen to use. And I don't know, I haven't looked at their website in a long time, but when I was graduating, it was an excellent source, and they had thousands of questions, and it was geared towards Canadian MCCQE1 tests. And then there's match statistics there on the side. We'll talk more about the match in general and what the more sort of recent statistics are. But you can see there's a large number of people that apply as IMGs, and you can see that there's, the match rate is reasonable. It's not zero. And there are certainly a large number of programs that even have dedicated positions available for IMGs, but I'll talk to you more about that. So this is sort of the general timeline. Again, the MCCQE1 I wrote at the end of my medical school training. The NAC you can write anytime within 12 months of graduating, and then the CARMS application, which we're going to talk about. So this is the timeline for CARMS. CARMS is the Canadian Residency Matching Service. And it's basically the program applications open in November, but really your journey or your process in CARM should start well before that. November is when you're really starting the application, but your time and effort putting into becoming a residents in Canada should start in advance of this. And that really speaks to trying to get as much face time in Canada as you can. And I'll talk more about that, because that's probably the biggest challenge being an IMG, is actually getting your face into the program and letting them know who you are, more than just applying on paper, which I think is probably the biggest factor. January, you can start selecting your programs that you want to apply to. And by February is really when things lock down. So that's usually when you have to sort of lock your rank list in and sort of have everything uploaded onto the website in terms of your personal statements and your letters, and any other documents that you need. They typically do need, the general stuff, passport information and all that kind of stuff. And then in March is when typically the match day has been in March, but I think this year it's been pushed back, which is why this timeline's a little later than the usual tip. I'm not sure what it'll be. This is for this year, but moving in the next couple of years, it may go back to the match day was usually in early March. And the interview process is between the applications closing and obviously the match day. Most programs will do an interview. I'm sure this year they managed to get them all done right before COVID hit, but going forward, I don't know if people are planning on doing Zoom interviews or if they're going to be doing in-person. Zoom interviews are great because you don't have to fly however many times you need to Canadian programs. In urology, we do a centralized interview day where it's basically, we call it the CARMS Fair, where every program flies to Toronto. And so applicants just have to fly to Toronto once and get all of it done in one day. That's to save people money. And then match day, which again is normally in March. Here it says April, and then the system closes. The match, I'll talk about first and second rounds of the match. That's important, especially as an IMG, to know about. But that's sort of the broad overview of kind of when the actual system is open and closed. So selecting and ranking candidates for the training program. So, like I said at the top, I've been on the selection committee. It's a very opaque process. Unfortunately, it's not standardized or anonymous or anything like it should be, probably. It's fairly transparent in terms of we, as the program, know who we're ranking. We know who you are. We see all your documents. It's not like, when you're reviewing a paper and you don't know who the authors are, to be unbiased. We know we unfortunately don't, we have access to all of that. Despite that, I think the process is fairly similar between programs. Really what a program is looking for is they want someone who's a team player, who gets along with the residents that are in the program already, who's well-rounded. Nobody expects the person applying to have already become a knowledge master in the area that they're applying for. You don't need to be a urologist to apply to become a urology trainee. You need to be a good medical student and a well-rounded person. And you have a good head on your shoulders, basically. Someone once told me they were looking for the third eye. They're looking for the eye in the middle of your head. It's sort of saying like they just want to make sure you're a good person and you're going to get along with people. Other than that, there are a lot of other factors that we take into account, and it really depends on the program that you're applying for. And that's why I think it's important to get to know the programs that you apply for. So for instance, the urology program I'm in is in Toronto. Toronto is a big academic university. So they do value academia research a little bit higher than other programs. But similarly, right down the road in Kingston, Ontario, which is about 2 hours away, they do a lot of research as well. But I think their residency program, they don't necessarily have the same expectation that their people they match will have done any research, will be doing that as their career. So these are things that you won't find written on a website. And the only way to really find this stuff out is to spend time in the program, speak to the residents that are already there, and find out kind of what the program is known for and sort of what their priorities are. What else can I tell you about selecting and ranking? The selection process really is based on how well they know you, which again is tough to do as an IMG because you don't often get the time to come and spend with the program. What I would try to say to you, I'll say it now and I may say it again later, is really try your best. However, there's financial issues, there's time issues. I totally get that it's very challenging and there's no perfect answer for this, especially now with COVID, that makes it even harder. But try your best if you can, if you have the means to set up an elective, to come and spend time at one or as many programs as you can in Canada, to get to know the people that you're applying to. So the program director, the chair of the division, the other faculty, but most importantly, the residents. Because at the end of the day, pretty much every program will lean on the residents to help make their rank list, certainly in our program. And so the more time you're here getting to spend actual face-to-face time with people, the more they'll know you, the more comfortable they'll be talking about you when they're deciding who they want to take. And like I said, if you're a nice, hardworking, well-rounded person, you're going to stand out. And especially amongst the IMG pool, because unfortunately, a lot of IMGs don't get the opportunity to go and actually see the program. So if you can show up, that makes a big difference. Is it 100% crucial that you are doing an elective before you match to a program? No. And I can only speak from urology. I would say most of the people we've taken that are IMGs have managed to get here and spend time with us, but that's urology in Toronto. I can't speak for the hundreds of other programs in other places. And but what I would say is that I know for a fact there are a lot of IMGs that match without coming here beforehand. And so the strength of your application, of course, does matter quite a lot. Yeah, and other recommendations, get letters written from people who really know you. When I applied the first time for my residency match, I got the chairman of the division in Toronto to write a letter. I got, well, someone high up at St. George's to write a letter for me. And it was obviously impressive to have letters from people like that. But at the end of the day, they don't really know me very well, or they didn't know me at the time. And it was difficult for them to speak to me as someone who you're applying for a job. So they sort of looked at my CV, I think, and wrote, he seems to be well-rounded, his grades are good. But they're already going to get that from your CV. They don't need to know that. What the letters need to show is more of the personal side. Mitch was hardworking. He showed up early for rounds in the morning. He did academic projects with me. He took great care of the patients. He spent time to get to know the patients. He was caring. All those things that you can't get on paper, that you can't put on a CV or on an application, that's where the letters are going to help you. And especially if you can't come to the program, if you can get a letter, ideally from someone who the people in the program know. So it doesn't have to be the preeminent leader in the world on a subject, but if it's someone who you're working with at your home institution who says, oh, I know Dr. So-and-so in Alberta or so-and-so in Newfoundland, then for that program that you're applying to, it may be of value to have a letter from them, because when the person who they know who's in the program who's going to be reading your letter says, oh, that's great, a letter from Mr. Smith, the surgeon in Cambridge, and they'll be able to at least sort of vet the person who's writing the letter. But that being said, even if they don't know the person, it's the most important thing I think for the letters is to have somebody who knows you on a personal level write the note, and who can speak to who you are as a person rather than who you are on paper. Other than that, I mean, personal statements, I think we all know there's lots of other resources. You don't even need to talk to you about that. Just, obviously try and make yours unique, all that kind of stuff. I don't have any real strong insights into writing personal letters. That's pretty much, I would say those are the most important parts of the application. Like I said, depending on where you want to go, what program you want to go to, research is important. Try and get involved. If you can see that far ahead that you're going to want to be in an academic program, try and get involved a little earlier in medical school, because research takes a long time, especially when you're busy with coursework and doing elective rotations in hospitals and trying to learn how to be a doctor. It's hard to also do audits and systematic reviews and all that kind of stuff. What I would recommend for research is systematic reviews are great because they're not clinical. You don't have to spend a lot of time mulling through patient charts or, doing trials or anything like that. It's you can do it in your own time. And the other type of project would be an audit, where you just look at the outcomes from a database and try and spin it into something where you can publish it. Try and do research you're interested in, because that will actually help you do it. Doing research is very difficult and takes a long time. And if you don't care about the subject, then you're not going to spend the time. and you're not going to, you're not going to put as much effort in. It's not going to be as good of a product. So pick something you're actually passionate about. And research is enormous. It doesn't have to be basic science in a laboratory, pipetting things or injecting mice with stuff. I did mostly education research when I was in medical school, but I did audits, clinical audits as well. I looked at from I think prostate biopsy at St. George's Hospital. The other thing I'll tell you about research is try and find a mentor. I think the key in picking a research mentor is you want to find somebody who is established enough that they have the resources where they can help you get a project through to the finish line. Whether that's they have a postgraduate person who works for them, or a clinical or sort of a research assistant who can help you with data, a statistician who's available to them. That's really helpful, but also pick somebody who has time for you. There's no point going to the biggest academic in your university and asking them to be your research mentor for your medical school project, because they won't have time, or they'll delegate you to someone else who's in their lab, and they're probably, you don't know what their reputation is like. So I'd recommend finding somebody who's in practice sort of as an academic, but not somebody who's necessarily university who's out of town all the time. Try and find somebody who has time for you, who can really mentor you, who has time to meet with you, who answers your emails. Because as a medical student doing research, you're sort of blind going forward. You've never done this stuff before, and I mean, I'm sure a few of you would have, but for the most part, you don't necessarily understand the nuance of getting an ethics agreement and getting a data sharing agreement and getting data and going through data. A lot of that takes a lot of time, and there's specific ways of doing it. What I would also say is that when you're applying and you're making your CV, it's more impressive to have research projects that have been completed than ones that are in progress. And I know that's another thing you guys are probably going, throwing your hands up in the air, like, what the heck am I supposed to do? But what I'd really try to do, if you can, is take a project in a perfect world from concept to it being published. That's the hardest thing, is to get things across the line. It's easy to say you were participating in research and you were participating in 20 projects, but you may have just been, because it's hard to understand how impactful your role was in that work if you were just a participant in a big group. It's more impressive certainly to be either the first author, or to say this, and be able to talk about, I was involved in the data collection or the data assessment and statistical side, or I was involved in writing the paper, and we got it published and it's in a journal, and here it is. That's much more complete from an academic point of view. Like I said, research is not the end all and be all. It happened to be important to the program I applied to. It is certainly not important to many programs. So if it's not of interest to you and you have you're not at all thinking of applying for a program that's an academically focused one, don't worry about it. Do a little bit of research if you can, just to make your CV a little bit more well-rounded, and if you have the time. But if you're doing other things like organizing international talks like this, or doing anything else that's also impressive, that's not academic necessarily, then if you find your passion, then just do that. Okay, that's a lot of talking about application. If you have other questions, this is the subject I think I can talk the most about, because I applied twice, and B, I've been on the selection committee side, so I kind of know what we look for when we're looking at the actual people that are applying. So I put some slides in about the match in Canada. You guys this is all going to be data, and it's going to be kind of boring. I'm not going to spend too much time on it. We can go back and look at the slides after if you want, but the website's there. Just go to the carms.ca website, and I think it's under reports and data, or data and reports or something, but you can pull up all the match data, and it's really useful because they break it down by program, and I'll show you that now. So this is first of all, so the first thing I'll tell you about the match in Canada is there's iterations. There's two of them. They're basically cycles. The first round, or the first cycle, is when you apply the first time, and programs will have posted their positions for the first round. Some programs will have IMG positions in the first round. So my program, the urology at University of Toronto, usually, not always, and this is the other problem, because it can change from year to year whether the program will post an IMG position. But for the most part, my program and many others will have a number or one or more IMG dedicated positions, meaning CMGs, Canadian medical grads, are not eligible to apply for those spots. They're reserved for IMG grads. And that's great, because it means the competition is much less. You're not applying for a CMG position. And that's, I don't know if you guys can see my pointer, but these are this is saying, are IMGs eligible in the first round of the match? And it's saying yes, 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 yes. So all these provinces are. It's saying, is it a parallel stream or a competitive stream? Meaning, is there IMG positions that are not, that the Canadian grads can't compete for, or C, competitive, meaning everyone's in on all the spots. So you'll see most of them do have parallel streams, which is really great for us. Return of service is something you need to look at before you apply for Canada. Most provinces have a return of service. You can see a few that don't, Alberta and Quebec mainly. Return of service is a contract you sign when you start your residency program that says that I think it's variable from province to province. In Ontario, it's you have to work in an area outside of a major city for 5 years to sort of pay back your residency training. I will not get into the politics of this because I have a lot of very strong opinions about this, but I don't know who's watching this or who disagrees with me, so I won't say anything. All I'll say is that it's a contract that you have to sign, and the expectation is that you'll be working after you graduate in Ontario. It's not the Greater Toronto area or the Greater Ottawa area, which is in Ontario. Fortunately, there's a lot of very sort of heavily populated city locations. If that's what you want to, if that's where you want to work, which I have a lot of friends that want to get out of the city. There are, if you still want to work in a sort of city environment, there are places outside of those two main cities that you can still work as an IMG. Second iteration, meaning are there positions available in the second round? Yes. Again, parallel versus competitive. You'll see that in the second round of the match. So after the first round of the match, most programs fill most of their spots, and I actually have that data coming up. But there's a second round for all the unfilled spots and for spots that are second round spots. And you'll see that now it's all switched. Mostly it's competitive, meaning that the CMGs who didn't match in the first round are also going for those positions with IMGs. Again, return of service, the same. It doesn't change between first and second round. This is a bit of a odd category. I didn't understand what this really meant. I think what it means is that if you have done training outside of Canada, that you are only eligible for certain rounds of the match. I might be wrong about that, so don't read into that too much. And I tried to figure this out. It says on the website, and you'll see there's a star under the table. If you're curious about reading about that, you can go find it. And this independent license thing, this is like you basically, as far as I'm concerned, everyone who graduates from a residency program in Canada gets an independent license to practice. This is, I'm not sure what they're trying to say here. Certainly for Ontario, every IMG is, there's no difference between first and second round in terms of what license you get at the end. These are the regional match results. So I know this is an international talk, so maybe you'll find your part of the world on here. I was Europe, where I went to medical school, but I have friends in my program who went to medical school in the Caribbean, actually quite a few. I believe St. George's was one of them, and AUC, I think, maybe. Anyways, there are lots of grads in Canada who were graduated from Caribbean schools, Australian schools, Irish schools, English schools, all over the world. South American schools, I know a few from a few South American countries. So there's all kinds of grads that come to Canada, and you can see that what the numbers were in terms of participation. So this is the most recent, and you can see the matching percentages. And I think it's overall fairly positive. I can't see any ones that plummeted off the map. Most of them went up. So there's a high percentages of that match from all these different places. And I mean, Mexico looks very high, but there's only 5 people that applied. So take that into account. Again, all this data is available on the CARMS website. This is again showing just a different way of showing the percentage matched. So this is the current year. So again, 61.3% overall IMGs matched. Yeah, and this is the first iteration, the second iteration. Again, another way of showing you the same thing. 2,000 IMGs applied initially, but only 1,500 or 1,400 ranked at the end. So there's a big, there's a large number of people that don't end up getting through the process from start to finish in terms of so even though 2,000 apply, which is a lot, there will be considerably fewer number of people that actually are in the final match. And then this is second iteration positions filled. So again, these are for people that didn't match to IMG positions, but IMG's is here, you can see them. This is ranked by different specialty types. So family medicine is obviously the highest number that take IMGs. I was surgery, so only a few people got in the second round. And then the sort of non-surgical disciplines like anatomical, pathology, all that kind of stuff is in there. For the most part, it's family medicine will have the most opportunity for matching. I think that's true in most countries, and all the sort of the less desirable positions for CMGs, which does not mean that the program is less desirable or that the specialty is less desirable. It just, for whatever reason, the stats are the way they are, and Canadians, there's certain programs they don't typically want to go into, and that's on this slide. So you can see here that these are the I wanted to show this is only talking about CMGs that sort of the spots were available, but I wanted to show you this mainly. So this is the unfilled at the end of the first cycle of the match. And look at family medicine. There's 170 spots at the end of the first round that are open and up for grabs. So that's a huge number of spots. And most of these will be in rural places, because family medicine residencies programs, there's tons of them. And they're not just in the big cities at the universities, they're university affiliated, but they can be in a different part of the province, further north or inland or wherever, where there's sort of an underserved area. And most of Canada is beautiful and very livable, and definitely up for grabs if you're interested in that. And even after the second iteration, 50 spots are left unfilled. So take that what you will. Either they're not matching people on purpose, or the competition is definitely not there, and those spots are very up for grabs. This is the other program. So this is part 2 of that table, the same sort of thing. So urology for me, not so open, but there are, like I said, Ottawa and Toronto are the IMG spots for urology in Canada. And then these slides basically talk about how candidates in a survey, basically how they ranked what was important to them when they chose their discipline. What I would say is that just choose the discipline you want. When I was applying, I had people telling me just apply for family medicine because it's going to be the highest chances of matching. And then once your foot's in the door, you can switch into another program. Switching into another program is not that easy. It's not that straightforward. It's possible if you really needed to. There are ways to do it, but it's very tricky because they can't just take another person into a surgical specialty. They have to usually find room for you, or someone has had to leave. And so switching programs is not as straightforward as you may have been told. Really, this is just showing you that it's really about, the types of patients you'll see, the opportunities to work with other people that you like, having a good personal life. These are the things that people value. And switching to another discipline, obviously people are going to say they're not interested in that, but I suspect that number is not completely true. I'm sure this is just survey bias. This is the location choice. Talk about the town and the city being important, leisure activities. What I'd say in Canada, like I said, is I've lived in Vancouver and Toronto, 2 big cities, both fantastic places to live. But I've also spent time in other parts of Canada. Small towns in Ontario are also beautiful, and people there are really friendly. And if you're into outdoor stuff, Canada is full of outdoor camping and hiking and canoeing and swimming, and it's a beautiful place to live. And just because you're not in a big city doesn't mean you won't have a good personal life outside of work. So that's the program and location choice. So how to be a competitive IMG. I've talked a lot about this already. So we have like 15 minutes left or 10 minutes left. I'm not going to get too much into it. What I would say to make yourself stand out, I think I've talked about that to death already. If you have more questions about that, we can talk at the end. But really, just be a well-rounded person, and then spending time in the program if possible, or at least making contact with the program as much as you can if you can't be there physically. Letters of reference from people that you know, and find out about academics and whether that's important. And if it is, try and get the academics done. Specialty selection. I'd say do what you love. It's going to be what you're doing for the rest of your life. So don't pick something just to get back to Canada. Although it's easy for me to say being on the other side of this, but But like we looked at in terms of just if you look at data, family medicine is probably the highest success for people that are applying as an IMG. We talked about competition and interviews. Like I said, the interview process is, I'm sure, variable between programs. For myself, it's really asking the usual interview questions. There's no surprises. You know, why, you know, family medicine, why urology, why Canada, why this city, why this program. So obviously you have answers ready to go, and maybe try and find unique things about the program that you want to talk about. So for me, I said the opportunity to do the surgeon scientist program in Toronto, which was this clinician investigator program, which is the opportunity to do a graduate degree during your training, which I did. And because I wanted to do an academic career, and so that was a big thing I harped on during the interview, which they liked, obviously, and the program that I matched to. But other than that, just be yourself. And that's really, I know it's kind of a cliche, but it's honestly true. They want to see what you're like as a person, because that's who they're going to have to work with for the next 5 years or 3 years. We talked about this already. The licensing exams you know about. I would encourage everyone to do as many exams. I did my USMLEs, I did my Canadian exams. Just be broad, keep all of your doors open. It's always useful. It's a pain to do them, but it's just, and also it's a cost too, which I know is a big, which is a barrier for some people, but it is what it is. You have to do what they ask you to do. Research, we talked about. Leadership, I think, like I said, if doing research is not your cup of tea, you don't have to be an academic in, med school when you're 20 years old. You don't have to be, writing first author papers, but find ways you can stand out as a leader. The guys who have put these series on, this is something that would look really good on their CV, that they've put this series together. If you're the head of a club or music society or anything like that, you can talk about where you've excelled in a non-medicine field. That's important. Competitive sports, competitive debates, competitive whatever, where you've been able to show that you can stand out outside of medicine. I think that's a really, really important thing. Electives, like I said, get in touch with people early if you can, if you're going to have the time. I know a lot of medical schools now are gearing their curriculum to IMGs, which is fantastic because they'll give you time and opportunity to do your electives in the country you want to go to. Try and do that as much as you can, as often as you can. I can't say that enough. And get in touch early with them. Try and spend time early. Obviously, don't go when you're a first-year medical student, you don't know anything or how to do anything, because they're going to be like, this person doesn't know what they're doing. Or if you do that, if that's your time to go, just make sure that you stress that you're very early in your training. But going towards the end of medical school where you're more competent, I think is really important, and kind of showing off your knowledge and your skill. And that's it. We talked about specialties already. Surgery is typically very competitive. I think ophthalmology is historically the most competitive. Dermatology is very competitive in Canada, but most surgical specialties are quite competitive. And then internal medicine and family medicine would be the least competitive, but by no means are they the least good. They are fantastic things to do. And I have lots of friends who are IMGs who are in those programs. Had a great time now, very well. Okay, I think I hopefully ended on time. It's 9:45 for me. I guess it's 2:45 for you. That's all I had to say. I'm very happy to answer your questions. I think Amanda's going to collect questions or post questions or give me questions after. So just stay in touch with them. Like I said, I have a very unique, I guess, perspective on all this stuff, in the sense that every IMG will have their own kind of path, which I think is both a strength and unfortunately a bit of a weakness, in that we can't always relate to each other's paths. And I know you all have questions. I'll do my best to answer them. But like I said, you've heard about my journey, and it may not be the same as yours. What I would say is that don't give up on applying and trying to sort of land where you want to land. But keep in mind the AFSR, which I think most of you should be, based on the title of this talk, is a great place to live and work. And I have many friends who are Canadian and American in particular, who have ended up staying in the UK. And you all know the foibles about the UK and the NHS and whatever else, but every healthcare system is the same, and they all have the same problems. But what I would say is that they're all very happy. They have partners or they don't, and they love being in England. And even when I matched and I was coming home to Canada, there's a big part of my heart that's still in London, and I miss it a lot. And I love living over there, and you know, working there was great, and they all get good training. We have fellows that come from the UK to do their surgical fellowships here, and they're all, for the most part, very competent, very good surgeons and clinicians and doctors. And I know postgraduate training is a little longer there, but I think we all come out the same at the end of the day. And whether it's academic or not, there's all kinds of great centers to work at up across the country that have international names, and you'll be able to live a very fulfilled and happy career there. That's obviously not the point of this talk. The point is coming back to Canada. So what I would say about that is just continue, keep pushing, try and be a well-rounded applicant. Don't try and pigeonhole yourself, and just don't give up. And you know, for me, I'm Canadian. I grew up here. I have a Canadian passport. I'm a citizen. My parents are doctors. I kind of had everything going for me at the time when I applied, and it still took me 2 times to match. So don't be discouraged if you don't match. Lots of Canadians don't match to their first choice, and just keep plugging away. Thank you very much. I'm gonna stop sharing my screen. I'll hand it back over to Amanda.
Thank you so much, Dr. Mitchell, for such a fantastic presentation. I think a lot of us learned a lot from it, from your perspective, your unique perspective. And I agree that, you know, every IMG has your own path to follow, and is different for everyone. It's a different type of situation, but the pieces of advice that you've given us are very, very helpful. And I hope everyone here is noting them down, because they're golden, you know. But we will also be posting this recording on our page, so you guys can watch over the presentation again. So that was going to be helpful. We can take around 15 minutes for some questions. A lot of questions have been going on the chat throughout the presentation, and a lot more now. And we also have some questions from you guys from the registration form. So Dr. Mitchell, if you don't mind answering to some of them, I'm gonna start with, do you have a return of service agreement after your residency, and what are the requirements to stay in Canada long term?
What are the requirements to stay in Canada long term? Well, so I guess something I didn't mention. Thank you for that question. That's a good question. It actually prompted me to say something else. I believe to apply to CARMS, you need to be a citizen or a permanent resident of Canada, I believe. I don't know if you can apply as an international in the sense of if you don't have one of those 2 things. That I may be incorrect in that. That may have changed. I hope your hearts aren't sinking, but just look on the website, look at the application. I'm fairly certain, though, it was that way when I applied. And then the return of service contract, that it's something that you sign that says that you're going to basically work in a part of Canada that's deemed underserved for 5 years. I believe most provinces are 5 years. And that's it. And there's a lot of clauses and sub-clauses to the contract in terms of, if you're going to do academia, you can still be affiliated with a university. You can still work part of the week at an academic center, as long as you're contributing a certain percentage of your time, your clinical time, to serving, medically serving an underserviced part of the province. But you know, in a place like Toronto, that just means you may be 45 minutes from downtown Toronto instead of 20 minutes from downtown Toronto. So doesn't mean you have to be in the middle of nowhere, which there's a lot of that in Canada, but it just means you have to be outside of those sort of real city parts of Canada, parts of the province. Yeah, I hope that somewhat answered your question.
Yeah, I think that was answered very well. Since you mentioned the website, the CARMS website, do you have any other resources that the participants here can go and look for further information?
Yeah, there is a whole society for Canadians who are studying abroad. Our so this is for Canadian citizens who are studying abroad. If that's you, I'm sure there are people in the group that are in the talk that are. It's called, we're working CSA. That's not an official title. CARMS doesn't have a special stream for Canadians. But CSA, so if you just Google CSAs, there's a whole society, there's a group of people who are sort of, I can't think of the term, who go to the government and ask them for, try and change the policies, make it easier for people to come back to Canada after training. Lobby, thank you, there you go, lobby the government. Other than that, not really. I'm sure most of the medical schools that you're at have IMG societies. And so I would just sort of latch onto them and go off their experience, speak to people that have recently graduated from your medical school. That's key. I had a lot of people ahead of me who were Canadians in my medical school who I could sort of watch how they applied, and that really helped. Or reach out to people who have already gotten into the Canadian programs and see what their journey was and sort of how they got here. I don't think there's a specific resource I would use. The CARMS website is really good, actually. It's all that data you can get just by looking on, you don't have to have a sign in or like a login or anything like that.
Yeah, it's a very good website. Thank you. Our next question is about the entrance, the license exams. A lot of people had questions about how do you prep for that and what's the best time to take them, the NAC and then the MCCQE,
Yeah, so I alluded to the MCCQE because that's the one I wrote. I'm sorry again, I can't speak my personal experience about preparing for the NAC OSCE, but what I can tell you about the MCCQE is doing questions was really crucial. What I would say is that the curriculum in my London medical school prepared me pretty well in terms of medical knowledge for that exam. And then the little Canadian ethical and Canadian healthcare system things you can pick up from question banks. And again, the one I used was Canada Q Bank. I don't have any sponsorship from them. I'm not trying to plug them for financial reasons. It's just the one that I used at the time, and I found it helpful. And I did quite well on the QE one, which was great. And I wrote it, I think, a month after, or 2 weeks after my it was called F year, my final year exams in medical school. And it was I didn't have to study. I didn't study anything extra really. I just threw in some Canadian questions while I was studying in the few months prior. The NAC, I think, is a fairly straightforward OSCE. The MCC QE2 is an OSCE that you don't have to worry about until you've matched in Canada, but it's again a general medical OSCE that you write at the end of or during your second year of training. And I think they're quite similar. I think the NAC is probably just basic broad medical knowledge to make sure that you have the basic clinical skills that's required of a doctor in Canada. So you can communicate with the patient, you can break bad news, you can you can do a basic like a cardiac exam and all that kind of stuff. There is a website also, the MCC, the Medical Council of Canada, has a great website. They have resources there. I was looking through their website before this talk, and they have a frequently asked questions section. They have a resources section. They have timelines when you need to apply and everything. So it should all be there. Okay.
Our next question is about the electives. And you mentioned that electives were needed for you. They were not essential, but of course they would help in the application, of course, because they ask you about if you know about the program and all. But someone asked about the electives being canceled because of COVID, and if that would have really a negative impact in the chances of being selected for residency.
No, and that's actually an excellent question. I didn't talk about COVID because I haven't been involved in the application process through COVID. But what I would say is I think actually in a kind of a weird way, it's a positive because the Canadians are also not doing electives right now, or they haven't been until now. So you're sort of on equal footing, in a sense. You get to both groups have not been eligible. I think now they're starting to look into opening electives again for Canadians. And they call the CARMS tour in Canada is the 4 months at the end of this year. So in your last year between September and December, basically, is when the Canadians all get on the road and go to the different programs across Canada and do electives, usually for 2 weeks, sometimes a month. But that's going to be pretty limited this year. I have a feeling it's not going to be the same as it's been in the past. Financially, with COVID, everything else going on, I don't think programs are going to be encouraging as many electives. And so I think a lot of it's been done through Zoom. There's a lot of webinars like this where the program director will give a talk and they'll say, welcome to whatever, University of Toronto Family Medicine. Here's what our program's about. And then you have the opportunity to engage with them and ask questions. honestly, my philosophy throughout basically my life, but speaking to people, especially who now in my position, who have been applying for fellowships after training and things like that, listen, if you don't ask, you don't get. You have to get out there. You have to be in touch with people. You have to kind of push for yourself. You got to just send in an application and not really be in touch and stand back is not going to be helpful. And it's really difficult. You don't know these people. Sometimes you're nervous to speak to them about yourself. It's not easy talking about yourself, but really try and get in people's ear. You have to balance that. Obviously, you don't want to be a nuisance, but you have to reach out and make contact with these people, because otherwise they won't know who you are. And if it nothing else, set up a phone call, set up a Zoom talk like that with them. Get to explain who you are, your journey, why you think you should be why you think you'd be good in their program, and just speak to them like a human being. And that's what all of them are. And if it's not there, if the connection's not there, if it doesn't go well, then probably that program is not for you, because that's the type of people that they are. But like I said, Canadians as a generality are all super friendly people, and you really shouldn't have any trouble, trying to network remotely if that's the only option that you have.
Yeah, thank you. Our next question is about what is one piece of advice you wish you'd had known going to the application process, and was the process easier or harder than you were expecting?
Well, I talked a little bit about the letters of reference. I was told beforehand you need letters from really impressive people. Try and ask the chair of the division at the program to write one of their letters. But I think what's more powerful, because what ends up happening is people that are in those positions get asked by everybody to write a letter, and they end up basically doing a template letter where it's all the same, and they just fill in a few different changes, like your name, maybe what percentile they thought you were in of people that were applying that year, that kind of thing. It's way more powerful as somebody who's on the committee reading one of these letters to have a letter from someone who actually knows you. The best is obviously someone who's well known and who knows you, like I was saying, but that's not always possible. But I would have at least one or two letters from people that really can speak to who you are as a person, who've worked with you closely. I had my registrar from Croydon, who was a great person. He was a great mentor when I was starting my F1 year. By the way, I didn't mention this. I sort of said I worked in Croydon. I did 3/4 of my F1 before I matched, and then I just didn't finish my F1 year. So you do not have to finish your F1. I know there's that license medical diploma thing at the end of F1. You do not need that to work in Canada. Anyways, but try and get letters from people who know you. And he wrote a great letter about, getting coffee with me and speaking about my personality and stuff like that, which is, I think, really important, especially when the program doesn't get the chance to know you as well as they may the Canadian graduates.
Okay, perfect. Guys, I know that we are short on time, but if you don't mind, we can answer questions for 10 minutes more. And don't worry, because I know that a lot of questions came at the end of the presentation, but Dr. Mitch kindly agreed to answer the questions that don't get answered here. And then we're going to be posting them to our page afterwards. So you guys will get everything cleared, the questions sorted out. So Dr. Mitch, are you fine answering for another 10 minutes?
Yeah, keep on going. And I see what everyone wants to know is, I think I dropped a bit of a bomb there in the answer section about the Canadian citizen or permanent resident. I'm trying to look on my phone. I mean, guys, go to carms.ca. I think I just Googled it, and I believe visa holders are not eligible. And that may be for first round, but just look on the website. Don't panic. But as far as I know, I'm refreshing myself while we give this talk. But I believe you must be sure you're eligible.
I think someone posted on the chat something that came directly from the website. Yeah. Yeah,
perfect. I see David and David. Yeah, that's probably the same thing I'm looking at. So I believe you must be a Canadian citizen or permanent resident of Canada. Visa holders are not eligible. It says that as number 4 on this thing I'm looking at, and you need the MCC EE exam. I talked about QE1. I didn't talk about EE. See, this is great. I'm reliving my life from 2012. There's also the EE exam. So I hope you guys are writing this down. There's the QE1 exam, which is what Canadian grads write at the end of their final year, which I did write. I wasn't lying. You do write that at the end of your final year. You also have to write the equivalency exam, the MCCEE. So make sure you look on the MCC website. I think I did that at the end of my 4th year, so 4 or 5. So that's an exam you have to write. That is a really straightforward exam. It's mostly like English proficiency, basic clinical knowledge. It was very straightforward. And I think studying for my exams at the end of my 4th year, which is sort of our general clinical rotation year at the school that I was at, I wrote the EE, and it was fairly straightforward. I think most people do pass that. But it's an equivalency exam. It's to make sure that you're sort of the bare minimum to apply for Canada. And then the QE1 is not part of the application process. So because you write it at the end of medical school, you may have already matched to your Canadian program. So the Canadian grads all write that at the end of their last year when they already know where they're going in July, at the beginning of their postgraduate training. So I completely overlooked that, and I apologize. You have to write the EE first, and then the QE1 at the end of medical training. And the NAC, I looked up, I actually read about it because I didn't do it. It says within 12 months of graduating, and I believe, of course, you can write it after you graduate. I think they just don't want you to write it in 2nd year or 3rd year, well in advance of finishing medical school. You have to be at least within 12 months. I saw somebody had written in the chat, can you write it after? I believe you can.
Okay, thank you for clarifying that. Another question that we got was about how important are publications for the application process, and do they look at the number of publications or the impact factor of the journal? Is it important to be a first author?
No, it's more essential. You really need to participate in research, and in the application process on CARMS, you say the project you're in, and then you get a little bit of a description. So you can write, what aspects of the project you're involved in, whether it's data collection, patient enrollment, whatever, writing the paper. My tip for people who are medical students here, who I meet in my day-to-day life, is what's really the easiest thing to do. It's not necessarily the best, but the easiest thing to do is to find a project that is ongoing, and to sort of ask if you can participate in that project, because getting a project from start to finish, like I said, is the most impressive, but is also the most difficult and the most time consuming. So a kind of a shortcut would be academic. Again, not too busy, but someone who has ongoing projects, and say, is there any data you have that's waiting to be written up? Do you have a project that I could write the paper for? Because often doing the research is often, for the people who are in academia, is kind of the thing. The machine will keep on turning, the data will keep coming, but writing the papers requires them to sit down and take time and look at other parts of the field and do like a lit review and all that kind of stuff, and that can take time. And so if you can be the person who does that for them, then often they'll give you first authorship, because you physically, you were the first author on the paper. So that's a nice way to get a first author paper. And make sure, a really important thing, before you get involved in research that you want to publish, be very clear with the PI, the person who's in charge, what your role is going to be and what your authorship is going to be. Nothing is worse than assuming you're going to be first author and spending all your days and nights working on something, and then you get to the end and they're like, I promised this person that they were going to be first author. You're going to be fourth author. Again, being fourth author is fine. You can still put it on your CV. It still looks good. Still shows that you're involved, but it can be upsetting and disappointing, and just make sure that everything is out in the open before you start. Guys, I apologize. I've seen somebody writing the MCCEE is canceled. I'm a dinosaur. So just look on the MCC website and make sure it should all be there. I apologize. I looked at the NAC because I didn't write that, but please look on the website and clarify. I'm just an old man now, and just make sure that you do your reading. The MCC website and the CARMS website are very good. Everything should be very clear. And if you have additional questions that you don't once you've looked at the website, I'm happy to sort of talk about them.
Yeah, thanks. Someone before, earlier in the talk, asked about work-life balance, and then Natasha just asked now about the living costs in Canada compared to UK and salary. So can you talk about work-life balance and then also pay?
I can talk about pay. So if you go on there's Canadian residency programs or Canadian residents. We have a union. In Ontario, it's called PARO, P-A-R-O. Also has a fantastic website. that you can look at, and it will list the salaries, and it's standardized first year, second year, third year, fourth year, fifth year. It goes up by year, and they're constantly being renegotiated with the government, and there's always changes, but the most recent ones will be up there. We recently got a pay rise, which was nice. But basically it just goes up by year. I believe our first year residents now, again, I'm sort of off the top of my head, I think it's between $50,000 and $60,000 Canadian a year, maybe slightly more. And by the time you're a fifth year resident, it's between 70 and 80, something like that. So it does go up pretty considerably each year, the longer the program you're in, obviously. Canadian physicians, actually all of this is also published. You can go online and see how much a Canadian doctor makes. It ranges anywhere from $100,000 to $100,000 to $1 million per year, even upwards of $1 million. There's a whole other, again, I won't get into politics. There's some problems, I think, with that, but that's my own side of things. But it's a fee for service system in Canada for the most part. So physicians here are independent contractors that work for a hospital, and you bill your services to the government. So it's a single, I didn't talk about the Canadian healthcare system very much. That wasn't the topic, but it's a fully public system. There is a private sector here, but it's only things that are not offered by the public sector is available. So like newly approved different types of technology, a lot of the cosmetic stuff is private here. But most doctors almost work 100% in the public system. It's not like England where there's like Bupa and all the private stuff. And it's fee for service. So what you do, you bill for, and there's billing codes for every procedure, every consultation, everything has a code associated with it that pays you a certain amount of money. So you need, people here have bookkeepers and stuff like that to take care of that for them. But there's apps on your phone you can download that will do all of your billing. This is a future thing. This is even future for me. But being a resident here, for the most part, it's not, the pay is not as good as the UK. I remember being an F1, I was making, I think, 40,000 pounds maybe a year, something like that, as an F1. You guys might be, again, screaming at me through your cameras, but I think that's what I made in Croydon, and the pay there. So that translates to a lot more in Canadian dollars. But I lived in London, so I had to pay for that too. I would say the cost of living is probably not as bad as London or New York or Los Angeles or those kinds of cities, but it's probably higher in places like Toronto and Montreal than it is in Cardiff or smaller sort of cities in the UK. Vancouver has the reputation in Toronto as being the highest cost of living. Graphic reasons and just housing costs and stuff like that. But other than that, it's pretty standard. There's no extremes in terms of living, like groceries or buying a beer is not considerably more expensive here than it is in the UK. I think it's probably cheaper here. But it's very geographically variable. Obviously, if you live in small towns, it's probably less expensive for certain things, but also more expensive for certain things, stuff that has to be brought to the town, obviously. So yeah, it's a very broad, open-ended answer, but I have friends who've left medical school in a lot of debt in Canada that are Canadian grads, and they're all doing fine. So I think it's manageable. It's not perfect. Hopefully that somewhat answers that.
Great. And what would you say that would be the value of an intercalated degree in comparison to a non-intercalated one?
So again, from my view on this, I can't speak for a program director or somebody who's going to be actually looking at the applications. I don't think it matters for Canada. It's kind of a blunt answer. The reason that I say that is because they're used to Canadian grads, and Canadian grads all have bachelor's degrees or master's degrees or something else other than their, very few people go into med school without another degree here. Rarely you'll hear about someone who got into medical school before they finished their undergraduate degree, but that's extremely rare and doesn't happen very much. It used to happen 30 years ago. It doesn't happen now. And, but because of that, you'd think, well, then shouldn't I have a BSc if everyone has, if everyone applies? I think it's the opposite. I think they just assume everyone has one, or that's not something they really look at. They're not like, oh, they did their undergrad in kinesiology. That's really, useful. I may be totally wrong for certain perspectives and to certain programs. Guys, please take what I say with a grain of salt. But my personal opinion is that I don't think it will hinder your ability to apply and get a job. I was never asked about that once. Nobody once said to me, "Oh, this is weird. You don't have a, bachelor's of arts. How come that is?" So again, my personal view is that I don't think it's necessary. Again, like I said at the beginning of the talk, so a few of my friends did it, and they got to live in England for an extra year and basically be like a med student for an extra year, and it's generally a less stressful year. So if that's something you need or something you'd like to do, I think there's no negative side of it, but no, I don't think it's 100% necessary. I don't really think it strengthens your application a noticeable amount.
Mm-hmm. And do you think there are any drawbacks of the Canadian system, and is it a big adjustment?
So again, guys, I'm Canadian. This is like home for me. I didn't grow up in Toronto, but a lot of family here, and I spent a lot of time here when I was a child. And so first of all, from a Canadian society point of view, there's no problem for me. Like I said, I think our culture and our society is very similar to the UK in terms of how people live day to day, what our kind of customs and cultural practices are, our multinational society, very sort of friendly, welcoming place. I know that experience is not universal for everyone, and I'm not speaking for everyone's personal view and personal experience, but I think that's the generality. The healthcare system here, we work very hard. I think residents are a key part of the healthcare system in Canada. One big difference is that in the UK, every hospital is a teaching hospital. So I remember going to these small hospitals in South London, and there would always be SHOs and registrars and F1s around. There'd always be trainees. There's always a postgraduate office, even if it's a little tiny office with a kettle and some tea and an old lady sitting there who's very nice, versus, the big medical schools that have a whole wing of the hospital that's dedicated to training. In Canada, there are academic hospitals and there are community ones. And the community hospitals typically do not get as many trainees. Some don't get any. So there are hospitals in the UK where there are no trainees. The doctors there, the consultants, the staff is what we call them here. They run the show. They take all the call. They see all the consults. They're in A&E in the middle of the night. They're doing everything. And so there's a bit of a difference there. We do electives in those community hospitals, and it's like an anomaly that we're there, and they're really happy that we're there because we can help them and pick up their call for them and see consults. So that's one big difference. Other than that, I mean, it's a public healthcare system. It has its downsides. Patients, you see, patients, there's sometimes wait times for procedures, or for certain, getting an appointment with certain specialists, but, and obviously just like any other country, there's problems with, access to care for certain groups, that we're continually trying to improve, and all the usual systemic issues that exist in other Western countries, I think, exist in Canada, and we're definitely not immune to that. And we have our problems, but for the most part, it's universal access to healthcare. It's a nice feeling being able to treat anybody that comes into the hospital. Yeah, I don't think there's any real negatives to the Canadian. Like, there are obviously problems, but I don't think as a trainee, I don't think there's any major drawbacks. Other than you work hard, you're relied on for taking a lot of call, and it's a tough couple years. Okay.
I think that if we were to answer all of the questions, we would spend the whole day here. I know there are a lot of unanswered questions, but we have noted down all of the questions, so they will get answered, guys. But of course, we would spend the whole day here trying to answer everything. So keep an eye on our page, because we'll be posting about that, probably sending an email with the answers. You guys are already on our mailing list, so you don't have to worry about registering to our future webinars, and you will get an email from us regarding the Q&A. I would like to thank Dr. Mitchell for taking time off his Sunday to come here and help us, about pursuing training abroad in Canada. I think this presentation was wonderful. A lot of people learned a lot about it. your perspectives, your pieces of advice. So thank you very, very much. If you don't mind staying here just for a little bit longer after participants leave, I'll be very grateful. For everyone else, just some final announcements. Please keep an eye on our social media because we're always posting updates about our future webinars. Also, we'll be sending out a feedback form, and it's very important for you to fill that up because you're going to have priority in registering for our next webinar, which is next Sunday, and it's Malaysia. So you all know that it's very competitive to get into this webinars. It's very popular out there, and you were the lucky ones for being here. So registrations, they fill up quick, and you will have priority if you fill the feedback form for this webinar. So keep an eye on your emails for that. And we'll be sending out the registration form for Malaysia next week. So also check your emails for that. Anything else? I don't think so. Thank you so much.
You guys can follow me on Twitter at Mitch Goldenberg, at Mitch Goldenberg, all one word. I see some people have already added me. That was a good prompt. Not that I tweet a lot about applying to Canada, but if you want to DM me about a specific message, I'll do my best to answer. And that's probably the easiest way to get a hold of me is through that. Sorry.
Thank you. Thank you. So follow him on Twitter. And I would just like to thank Seth and Onis. You know, we're all very happy for you guys being here, for Dr. Mitchell for giving his amazing presentation. And thank you so much. We really hope to see you next weekend for Malaysia. And have a great Sunday, everyone. Bye. Dr. Mitchell, if you can stay just for a little longer.
I'm staying.
Thank you.